have to look good. Okay, everybody, this is the second video on vertigo in this series. The first video was talking about kind of the intake history and just kind of getting a good feel for what the person is presenting with before you start taking them into different tests. So this is a good test to start with before you do too much else. This is a test to check your vertebral artery. So for compression there. Pretty simple test. You can almost kind of do it along with the Dix-Hallpike, but I'm just going to show it to you now. So basically what you do is you're going to take the patient laying on their back, and you're going to, actually I'll just tell you, you're just going to lay them on their back. You're going to have their head extended, rotated, and turned to one side. So they'll end up like this. They'll go backwards, off the end, and you're going to hold their head with your hands. So extend to the side and turn to that side. And so you're actually, even though I'm turning to my right side, you're actually testing their left side on that one. And you typically hold it for about 30 seconds or so. And what you're looking for is, oftentimes you'll just have them count backwards from like 20 or 10. So you want to hear them talking on this one. And so you'll have them counting backwards. And you're looking for a few different things. It shouldn't look like the Dix-Hallpike, first of all, which is a little more like positional vertigo, which I'll explain in the next video. But they'll often have some vertigo-like symptoms, or they can have difficulty with talking, they can have visual changes, they can start sweating, things like that. So that's why you have them count, because if they start to lose their ability to speak and things like that, then you're looking at compression of that vertebral artery. We don't tend to treat this. So it's one of those things that you just want to check off your list as kind of a red flag, and then refer them back to their doctor if you think there's an issue with that vertebral artery and it's kind of stopping flow to their brain. So again, this is one test you might just keep in mind. If you're doing the Dix-Hallpike, you're kind of in a similar situation or position. So if they're not getting what you consider a positive result on the Dix-Hallpike, where it's indicating, you know, vertigo, but then you keep them there a little longer in that same position and they start to have like difficulty speaking or changes in their vision. There's several other things you look at for that, but any of those weird changes, then you're thinking more vertebral artery. So that's a good test to keep in mind early on when you're assessing these folks. Next video, I'm going to show you some of the positional testing with Dix-Hallpike. So that'll be next. Thanks.